Question 1. A neutropenic patient with an ANC of 450 per cubic millimeter develops a temperature of 38.4 degrees Celsius, 101.1 degrees Fahrenheit. What is the nurse's first priority? A. Notify the healthcare provider immediately. B. Administer antipyretic medication. C. Place the patient on contact precautions. D. Increase oral fluid intake. Answer. A. Notify the healthcare provider immediately. Rationale. An ANC less than 500 per cubic millimeter with fever indicates neutropenic sepsis, a medical emergency requiring urgent provider notification for rapid IV antibiotic initiation. Antipyretics mask fever, but do not treat the infection. Contact precautions are inappropriate unless a specific pathogen is known. Fluids are supportive, but not the priority. Question 2. A patient admitted for Clostridioides difficile infection is improving, but still has loose stools. Which infection control measure must remain in place? A. Airborne precautions. B. Droplet precautions. C. Contact precautions with soap and water hand hygiene. D. Protective isolation. Answer. C. Contact precautions with soap and water hand hygiene. Rationale. C. Difficile spores require contact precautions and soap or water hand washing because alcohol-based rubs do not kill spores. Airborne and droplet precautions are unnecessary. Protective isolation is for immunocompromised patients. Question 3. In the ICU, 2 patients are both receiving mechanical ventilation. One develops ventilator-associated pneumonia, VAP. What is the most critical nursing intervention to prevent spread? A. Change ventilator tubing daily. B. Perform hand hygiene before and after contact. C. Use sterile gloves for oral suctioning. D. Administer prophylactic antibiotics to both patients. Answer. B. Perform hand hygiene before and after contact. Rationale. Hand hygiene is the most effective way to prevent VAP transmission between patients. Changing tubing daily increases infection risk. Sterile gloves help, but hand hygiene is paramount. Prophylactic antibiotics are not recommended. Question 4. A patient with suspected meningococcal meningitis is admitted. Which action must the nurse perform first? A. Place the patient in airborne isolation. B. Initiate droplet precautions immediately. C. Start IV antibiotics. D. Send cerebrospinal fluid for culture. Answer. B. Initiate droplet precautions immediately. Rationale. Meningococcal meningitis spreads via large droplets. Droplet precautions must start before diagnostics to prevent transmission. Airborne is unnecessary. Antibiotics are urgent but secondary to containment. Cultures follow isolation. Question 5. A nurse is caring for 4 patients. Which patient requires immediate implementation of airborne precautions? A. A patient with shingles in a dermatomal distribution. B. A patient with suspected tuberculosis. C. A patient with influenza-like symptoms. D. A patient with MRSA in a wound. Answer. B. A patient with suspected tuberculosis. Rationale. TB spreads via airborne particles. Isolation must occur immediately. Localized shingles needs contact precautions. Influenza requires droplet. MRSA wound needs contact precautions. Question 6. A patient on chemotherapy develops oral thrush. Which intervention is most appropriate? A. Implement protective isolation. B. Use airborne precautions. C. Initiate droplet precautions. D. Apply contact precautions. Answer. A. Implement protective isolation. Rationale. Oral thrush in immunosuppressed patients indicates risk for systemic infection. Protective isolation prevents exposure to pathogens. Airborne/droplet precautions are for specific infections. Contact precautions aren't primary here. Question 7. Which PPE is required for cleaning a room after a patient with Ebola virus disease? A. Gloves and gown only. B. Full PPE with N95 respirator, face shield, impermeable gown, and double gloves. C. Surgical mask and gloves. D. N95 respirator and gloves only. Answer. B. Full PPE with N95 respirator, face shield, impermeable gown, and double gloves. Rationale. Ebola requires maximum barrier precautions due to highly infectious bodily fluids. Limited PPE fails to provide adequate protection. Question 8. A post-op patient develops redness, swelling, and warmth around the surgical incision with a temperature of 39 degrees Celsius. Which assessment finding would confirm a systemic infection? A. WBC 7,800 per cubic millimeter. B. Blood cultures positive for Staphylococcus aureus. C. Slight purulent drainage at incision. D. Local tenderness at site. Answer. B. Blood cultures positive for Staphylococcus aureus. Rationale. Positive blood cultures confirm bacteremia, a systemic infection. WBC in normal range does not confirm. Drainage and tenderness indicate local infection. Question 9. While preparing to insert a Foley catheter, the nurse drops the sterile gloves on the floor. What should be done next? A. Pick them up and continue. B. Disinfect the gloves with alcohol. C. Obtain a new sterile glove package. D. Proceed without gloves to save time. Answer. C. Obtain a new sterile glove package. Rationale. Dropped sterile items are contaminated. New sterile gloves must be used to maintain asepsis. Alcohol does not sterilize gloves. Proceeding without gloves is unsafe. Question 10. A nurse is caring for a patient in airborne isolation who needs to be transported for a chest x-ray. What is the most important intervention? A. Place a surgical mask on the patient. B. Place an N95 mask on the patient. C. Keep the patient in isolation until imaging is portable. D. Wear full PPE during transport. Answer. A. Place a surgical mask on the patient. Rationale. For airborne pathogens, a surgical mask on the patient prevents spread during transport. N95 is for staff, not the patient. Portable imaging is ideal, but not always feasible. Question 11. A nurse suspects a central line-associated bloodstream infection CLABSI. Which action is most important to prevent further risk? A. Replace the central line immediately. B. Strictly adhere to sterile technique during line care. C. Flush the line frequently. D. Administer prophylactic antibiotics. Answer. B. Strictly adhere to sterile technique during line care. Rationale. Sterile technique prevents CLABSI. Line replacement may be necessary, but not first. Flushing doesn't prevent infection. Antibiotics are not preventive. Question 12. Which situation requires droplet precautions? A. Measles. B. Varicella. C. Influenza. D. Tuberculosis. Answer. C. Influenza. Rationale. Influenza spreads via droplets. Measles or varicella require airborne precautions. TB requires airborne precautions as well. Question 13. A patient with severe diarrhea is suspected of having norovirus. Which statement about hand hygiene is correct? A. Alcohol-based sanitizer is sufficient. B. Soap and water must be used. C. Hand hygiene is not necessary with gloves. D. Sanitizer should be used before and after glove use. Answer. B. Soap and water must be used. Rationale. Norovirus is resistant to alcohol. Soap and water are necessary to remove the virus from hands. Gloves do not replace hand hygiene. Question 14. A nurse must collect a sputum sample from a patient with possible TB. Which PPE is essential? A. Surgical mask. B. N95 respirator. C. Face shield only. D. Gown only. Answer. B. N95 respirator. Rationale: TB requires airborne precautions and N95 respirator use for aerosol-generating procedures. Surgical masks do not protect against airborne particles. Question 15. Which patient should the nurse place in a private negative pressure room immediately? A. Patient with pertussis. B. Patient with measles. C. Patient with RSV. D. Patient with C. difficile. Answer: B. Patient with measles. Rationale: measles requires airborne isolation with a negative pressure room. Pertussis needs droplet precautions. RSV and C. difficile need contact precautions. Question 16. A nurse caring for a patient with chickenpox must also care for an immunocompromised child. What is the safest assignment modification? A. Wear gloves when with the child. B. Assign another nurse to the immunocompromised child. C. Place the child in contact precautions. D. Have the child wear a surgical mask. Answer: B. Assign another nurse to the immunocompromised child. Rationale: immunocompromised patients must be protected from airborne viruses like varicella. Avoiding exposure is safest. Question 17. Which infection control measure is most effective in preventing catheter-associated urinary tract infections, Scotty? A. Frequent irrigation of the catheter. B. Maintaining a closed drainage system. C. Daily replacement of catheter. D. Use of prophylactic antibiotics. Answer: B. Maintaining a closed drainage system. Rationale: closed drainage prevents bacteria entry. Irrigation and frequent changes increase infection risk. Antibiotics are not preventive. Question 18. A patient with open pulmonary TB is coughing excessively during morning rounds. What is the nurse's immediate action? A. Close the patient's door and ensure negative pressure ventilation. B. Administer cough suppressant medication. C. Place the patient in droplet precautions. D. Provide a surgical mask for the nurse. Answer: A. Close the patient's door and ensure negative pressure ventilation. Rationale: containment of airborne particles is the priority. Medications and droplet precautions are inappropriate for airborne TB. Question 19. A nurse notices a colleague removing gloves after wound care but not performing hand hygiene. What is the best immediate response? A. Remind the colleague to wash hands immediately. B. Report the colleague to management. C. Assume it's not important if gloves were worn. D. Document the incident only. Answer: A. Remind the colleague to wash hands immediately. Rationale: immediate correction protects patients from infection. Reporting and documentation follow if the behavior continues. Question 20. A patient with MRSA in a surgical wound needs to ambulate in the hallway. What is the most appropriate nursing action? A. Have the patient wear a gown and gloves. B. Cover the wound with a clean, dry dressing. C. Apply an N95 respirator to the patient. D. Restrict all movement until wound heals. Answer: B. Cover the wound with a clean, dry dressing. Rationale: covering the wound prevents MRSA spread. Gowns or gloves for the patient are unnecessary. N95 is for airborne pathogens. Total restriction is not required. Question 21. A patient with neutropenia, ANC 450 per cubic millimeter, requires which most appropriate nursing action to reduce infection risk? A. Encourage daily group therapy. B. Place in a positive pressure room. C. Initiate airborne precautions. D. Avoid all cooked foods. Answer: B. Place in a positive pressure room. Rationale: a positive pressure room prevents entry of airborne pathogens, protecting immunocompromised patients. Group therapy increases exposure risk. Airborne precautions are for specific pathogens, not general neutropenia. Avoiding all cooked foods is unnecessary. The focus is on avoiding raw or undercooked foods. Question 22. In the event of a Clostridioides difficile outbreak, which measure takes priority? A. Switching to alcohol-based hand rubs. B. Using soap and water hand washing. C. Restricting visitors completely. D. Providing antibiotics to all patients. Answer. B. Using soap and water hand washing. Rationale. Alcohol does not kill C. difficile spores. Mechanical washing with soap and water is required. Visitor restrictions may help, but are secondary. Prophylactic antibiotics are inappropriate. Question 23. While caring for a ventilated patient with multi-drug-resistant Acinetobacter infection, which PPE combination is essential? A. Gloves only. B. Gloves and gown. C. Gloves, gown, and N95 mask. D. Gloves, gown, and surgical mask. Answer. D. Gloves, gown, and surgical mask. Rationale. MDR Acinetobacter can be spread via droplets and contact, requiring gown, gloves, and a surgical mask. N95 is not needed unless airborne precautions are indicated. Question 24. Which patient assignment would be most appropriate for a nurse recovering from influenza symptoms? A. Immunocompromised chemotherapy patient. B. Postoperative hip replacement patient. C. Stable patient on contact precautions. D. Newborn in NICU. Answer. C. Stable patient on contact precautions. Rationale. Nurses recovering from infections should avoid high-risk populations, immunocompromised, post-op, neonates. A stable contact precaution patient poses less transmission risk. Question 25. A patient with suspected measles is placed in a negative pressure room. Which action should the nurse take before entering? A. Wear a surgical mask. B. Wear an N95 respirator. C. Double glove. D. Use shoe covers. Answer. B. Wear an N95 respirator. Rationale. Measles is airborne. N95 respirators are required for entry. Surgical masks are inadequate. Double gloving and shoe covers are unnecessary for this pathogen. Question 26. What is the best initial step if a patient develops sudden chills, high fever, and hypotension 30 minutes after central line insertion? A. Notify the rapid response team. B. Administer prescribed antipyretic. C. Remove the central line immediately. D. Collect blood cultures from the line and periphery. Answer. D. Collect blood cultures from the line and periphery. Rationale. Suspected catheter-related bloodstream infections require cultures before antibiotics or removal. Rapid response may be needed after diagnostics. Question 27. In the OR, which action is most effective to prevent surgical site infections during long procedures? A. Increase or temperature. B. Maintain normothermia of patient. C. Administer extra oxygen. D. Use prophylactic antibiotics every hour. Answer. B. Maintain normothermia of patient. Rationale. Hypothermia during surgery impairs immune function and wound healing. Overheating, excessive oxygen, and frequent antibiotics do not directly prevent SSIs effectively. Question 28. Which infection control principle applies when transporting a patient with active pulmonary tuberculosis to radiology? A. Patient wears an N95 respirator. B. Patient wears a surgical mask. C. Nurse wears an N95 respirator. D. No precautions needed once outside isolation room. Answer. B. Patient wears a surgical mask. Rationale. Surgical masks contain respiratory droplets from the patient. The nurse needs an N95 in the room, but not during transport if distance is maintained. Question 29. A nurse observes a colleague failing to perform hand hygiene after glove removal. What is the most appropriate immediate action? A. Report to infection control after the shift. B. Remind the colleague to wash hands immediately. C. Document the incident in the patient chart. D. Ignore if no visible contamination occurred. Answer. B. Remind the colleague to wash hands immediately. Rationale. Direct, timely intervention prevents harm and promotes patient safety. Documentation and reporting can follow if needed. Question 30. A patient with bacterial meningitis requires which priority infection control precaution? A. Airborne. B. Droplet. C. Contact. D. Protective. Answer. B. Droplet. Rationale. Meningitis caused by Neisseria meningitidis is transmitted by large droplets. Droplet precautions are essential until 24 hours after antibiotics. Question 31. Which action prevents ventilator-associated pneumonia most effectively? A. Maintain continuous sedation. B. Keep head of bed at 30 to 45 degrees. C. Change ventilator tubing daily. D. Perform oral care every 12 hours. Answer. B. Keep head of bed at 30 to 45 degrees. Rationale. Elevation reduces aspiration risk, a major cause of VAP. Daily tubing changes are unnecessary. Sedation increases risk. Oral care should be more frequent. Question 32. For a patient with Ebola virus disease, which additional precaution is critical beyond standard PPE? A. Dedicated medical equipment. B. Negative pressure isolation. C. Airborne precautions only. D. Visitor restriction after 48 hours. Answer. A. Dedicated medical equipment. Rationale. Equipment must not be shared to prevent transmission via contaminated surfaces. Ebola spreads by contact with body fluids. Question 33. What is the first nursing action when a sterile field is contaminated during a dressing change? A. Continue with procedure quickly. B. Remove gloves only. C. Replace the sterile field completely. D. Cover the contaminated area with sterile drape. Answer. C. Replace the sterile field completely. Rationale. Once contaminated, the entire sterile field must be replaced to ensure sepsis. Partial fixes risk infection. Question 34. Which patient is at highest priority for protective isolation? A. Burn injury with extensive wounds. B. HIV positive with CD4 count 500 per cubic millimeter. C. Post-splenectomy with WBC 8000 per cubic millimeter. D. Bone marrow transplant with ANC 200 per cubic millimeter. Answer. D. Bone marrow transplant with ANC 200 per cubic millimeter. Rationale. Severe neutropenia places this patient at extreme infection risk, requiring strict protective isolation. Question 35. A nurse is caring for a patient with suspected avian influenza. Which precautions are needed? A. Standard and contact only. B. Droplet, contact, and airborne. C. Airborne only. D. Droplet only. Answer. B. Droplet, contact, and airborne. Rationale. Emerging respiratory viruses require combined precautions until transmission routes are fully understood. Question 36. Which strategy is most effective in reducing catheter-associated urinary tract infections, Caudy? A. Irrigate catheter daily with saline. B. Remove catheter as soon as possible. C. Use antimicrobial ointment at meatus. D. Keep drainage bag above bladder level. Answer. B. Remove catheter as soon as possible. Rationale. Minimizing catheter duration is the strongest evidence-based method to prevent CAUTI. Question 37. What is the primary rationale for changing gloves between care of different wound sites on the same patient? A. To prevent nurse contamination. B. To reduce cross-contamination between wounds. C. To comply with hospital policy. D. To maintain glove integrity. Answer. B. To reduce cross-contamination between wounds. Rationale. Different wounds may harbor different organisms. Glove change prevents spreading pathogens from one site to another. Question 38. A patient in the ICU develops sudden fever, hypotension, and positive blood cultures for Candida. Which risk factor is most likely? A. Prolonged mechanical ventilation. B. Indwelling urinary catheter. C. Long-term central venous catheter. D. High-flow nasal cannula use. Answer. C. Long-term central venous catheter. Rationale. Candida bloodstream infections are strongly associated with prolonged central line use. Question 39. Which teaching point is essential for a home care patient with MRSA wound infection? A. Dispose of dressings in biohazard bags. B. Wear gloves only if drainage is present. C. Share linens only after washing. D. Wash hands after dressing change. Answer. D. Wash hands after dressing change. Rationale. Hand hygiene is the single most effective way to prevent MRSA spread. Gloves are important, but hand washing is critical. Question 40. Which is the safest action when performing oral suctioning on a patient in Droplet Precautions? A. Wear gloves and mask only. B. Wear gloves, gown, mask, and eye protection. C. Wear gloves, mask, and shoe covers. D. Wear gloves and N95 respirator. Answer. B. Wear gloves, gown, mask, and eye protection. Rationale. Suctioning generates droplets and splashes. Full PPE with eye protection prevents mucous membrane exposure. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.